for joining us. My name is Danielle Baird, and I am the program coordinator for Michigan Green Communities. Thank you so much for coming to our Introduction to Health and All Policies today. Today's webinar is being put on, on behalf of Michigan Green Communities, as well as our partners at the Michigan Department of Health and Human Services and the Catalyst Communities Program through the Department of Environment, Great Lakes, and Energy. If you're not already familiar with Michigan Green Communities, in gist, it is a benchmarking and a sustainability benchmarking and networking program for cities, villages, counties, and townships all across Michigan. It is a free program to participate in. We do an annual benchmarking challenge that I invite everybody to take part in. And our goal is to accelerate environmentally sustainable actions by communities with the goal of enhancing Michigan's livability and economic competitiveness in the 21st century global green economy. So I want to take a moment to thank our partners as well, the Michigan Department of Environment, Great Lakes, and Energy, Michigan Association of Counties, the Michigan Department of Health and Human Services, the Michigan Economic Development Corporation, the Michigan Municipal League, the Department of Natural Resources, Department of Transportation, and the Michigan Townships Association. I'd also like to thank our steering committee members that represent all of these agencies, as well as the communities that are represented on our steering committee as well. Really quickly, I want to talk about Catalyst Communities. If you're not already familiar with this program, this is a really great repository of information that includes education, training, planning, and technical resources around sustainability, including things like decarbonization, mobility, and they have a bunch of really great resources that relate directly to the Michigan Green Communities Challenge. And so they, like I said, they talk about decarbonization as well as resources for emergency response and public health as it relates to climate. So I'd highly encourage you to check that out. I can drop a link in the chat in just a little bit if you're interested in learning more, or you can just Google Catalyst Communities and EGLE and you'll find it. And then really quickly, coming up on October 24th and 25th, is the Michigan Sustainability Conference that's taking place in Lansing. And those communities that took place in the 2021 Michigan Green Communities Challenge get 2 free registrations. Let me know if you need that code. There's also a pre-conference workshop that I think everybody here would be interested in with the Catalyst Communities program. Additionally, the Michigan Green Communities Challenge is going to open up in December, so watch your inbox for that. Here's just our Twitter and LinkedIn information and our website, migreencommunities.com/sign-up. And if you want to get more news and updates from us, just check us out on Twitter, LinkedIn, or sign up for our email. Okay, so to get started, now that we've gotten through some of those things, few housekeeping items, please keep yourself on mute until you're ready to ask a question during some of the more participatory pieces. And I'm going to introduce our speaker today for this Introduction to Health and All Policies. Julia Field is the program manager for the Michigan Climate and Health Adaptation Program. This is part of the Division of Environmental Health with the Michigan Department of Health and Human Services. Her pronouns are she, her. Julia, if you want to give a little bit more about your background as well, once we stop sharing the screen here, and I'm just going to hand it over to Julia now.
Sounds good. Thanks, Danielle. I will quickly share my screen. Okay. Make sure it's all situated correctly. All right. Yes, thank you for the introduction. As Danielle said, I'm Julia Field, the program manager of the Michigan Climate and Health Adaptation Program, which is within the Division of Environmental Health here at the Michigan Department of Health and Human Services. The mission of our program is to ensure that climate change is recognized as a public health issue and that climate adaptation and resilience is integrated into public health practice. While I now work in public health, I earned my master's in city planning from the Massachusetts Institute of Technology, where I focused on environmental planning and healthy cities. So I'm very excited to be here today to give a basic introduction to the framework called Health and All Policies. And because my program focuses on climate health adaptation, I'll also discuss how we add climate health to the Health and All Policies framework. So the objectives today are to define health and all policies, to know the tools and methods to integrate health into your work, and finally to apply health and all policies to climate and health adaptation planning. The origins of urban planning are rooted in public health. While planning and public health are viewed as distinct disciplines today, they emerged around the same time in the late 1800s with a shared interest in preventing infectious disease outbreaks in cities. These outbreaks were primarily cholera and typhoid. Industrialization and urbanization created poor and unsanitary living and working conditions. In response, public health and planning worked together to establish water sanitation standards, housing standards, light and air quality standards, industrial plant safety, and other standards related to the welfare of employees. These infrastructure projects helped to address issues with sewage, garbage, and pests, and planners became involved in the municipal regulation of land uses. Over time, the disciplines diverged. Public health shifted focus from the urban infrastructure to a smaller scale in the laboratory, where they studied the microbes responsible for disease. Meanwhile, urban planning continued to focus on land use and zoning, but was increasingly involved in suburbanization and economic development by the 1950s. You fast forward to today, and land use decisions, housing policies, and other transportation projects of the 20th century have contributed to many of the public health issues we face. From the walkability or non-walkability of suburbs to the disinvestment of urban cores, the distribution of locally undesirable land uses, and where and how people access mass transportation and consequently healthcare, groceries, schools, jobs, etc. All these factors influence health. So over the last decade or so, public health and planning have once again begun to share similar goals, largely due to public health's interest in addressing what are called the social determinants of health. The social determinants of health acknowledge that health is influenced by the social, physical, and economic environments, and that these environments often have a greater impact on how long and well people live than medical care itself. I'm going to play this video from the University of Michigan, which provides a more in-depth definition, and the audio should work, but let me know if it doesn't. Always such inspirational music in those videos. Anyways, addressing social determinants of health goes beyond public health, and therefore public health must partner with those who make decisions on transportation, education, housing, and environmental planning in order to improve health outcomes. The Michigan Department of Health and Human Services has a social determinants of health strategy that actually launched this year. The strategy takes a focused approach to align efforts at both the state and local level for greater impact in communities. In 2022, they had 3 focused areas for their strategy that include health equity, housing stability, and food security. I encourage you to reach out to them if you'd like to learn more or partner in their strategy. So this leads us to health and all policies framework. Given that public health must partner with those outside of public health in order to improve the outcomes related to the social determinants of health, a health and all policies concept emerged. Health and all policies is a collaborative approach to improving the health of all people by incorporating health considerations into decision-making across sectors and policy areas. Today, we'll walk through some of the key elements of health and all policies as outlined by the American Public Health Association and American Planning Association. But I also want to emphasize that health and all policies can be understood through a spectrum of engagement. It could be a very involved process, or it could simply mean considering health impacts of a policy or plan as you develop it. So why should public health and planning work together? I assumed a majority of you in attendance today would be planners, so that's kind of what this is focused towards. As you all may know, public health would benefit by working with planners because you all influence projects that shape the built environment, raise awareness among community members and decision makers that healthy communities can promote economic prosperity, and you elevate health considerations within big picture community planning processes. Now, you as planners would benefit from working with public health professionals because they play a key role in collecting and sharing community health data. They communicate the importance of planning decisions for promoting community health, safety, and welfare. And finally, they engage community members in a way that is inclusive and representative of all perspectives. This slide is from the American Planning Association. They put out a fact sheet this year called Fostering Healthy Communities Through Planning and Public Health Collaboration, and I highly recommend it as a good resource. So before diving into details of health and all policies, it's worth pointing out that a lot of the work that you do as planners already have positive health impacts. So to highlight how policy interventions could benefit both disciplines, this table shows the co-benefits of several public policy interventions. In the first example, if you increase access to and diversify transit opportunities, the public health benefits include increased physical activity, reducing local air pollution, and increasing access to social services and healthcare. For community planning, the benefits of this policy are reduced congestion, increased foot traffic to businesses, and support for market-based, high-density, multi-use developments. As another example, we have the utilizing complete streets design strategy, and this as well has a number of public health benefits, which include increasing shade and adding greenery to neighborhoods, increasing walkability and bikeability, and reducing combined sewage overflow and sewer backup events. For community planners, it benefits stormwater management as green infrastructure. It reduces wear on infrastructure, and it encourages place-based economic development. So it's very possible that projects you already work on have positive health impacts. So according to a really helpful guide from the American Public Health Association called Health and All Policies, a guide for state and local governments, there are 5 key elements to working towards health and all policies. The first element is to promote health, equity, and sustainability. This can be done by incorporating health, equity, and sustainability into programs and processes. And if all 3 become embedded into decision-making, health public policy becomes the normal way of doing business. For number 2, we have support intersectoral collaboration. Intersectoral is a fancy and weird way of saying that you work outside of your own department or your agency or discipline to address angles of a shared problem. This breaks down silos and it builds new partnerships to promote health and equity and increase government efficiency. Number 3, benefit multiple partners. Health and all policies is built upon the idea of co-benefits and win-wins. A health and all policies process helps agencies to achieve these co-benefits and create efficiencies across agencies. The co-benefits we discussed in the previous slide with the diversified transit options and complete streets are examples of how a public policy benefits many agencies, including both planning and public health. Number 4, engage stakeholders. This is already pretty common practice in planning, but the idea here is to include a diverse array of community members, policy experts, advocates, private sector partners, etc., in the policy planning phase. Robust stakeholder engagement is essential for ensuring that public policy is responsive to community needs and helps policymakers gather valuable information necessary to create meaningful and impactful change. And finally, create structural or procedural change. So over time, this process can create permanent changes in how agencies relate to each other and how government decisions are made. The ultimate goal is to ensure a health and equity lens is applied in the decision-making processes across the whole of government. This slide shows some of the ways to incorporate health and all policies through government mechanisms, which are shown in the left column, with specific actions shown in the right column. For example, through data sharing, The collecting, standardizing, and disseminating of data increases use of data across agencies for more effective collaboration. So through data sharing, a city could include indicators related to environmental health and transportation plans, and likewise, indicators related to income, housing, employment, and transportation that could be included in health department reports. With education and information collaboration, non-health agencies could educate and interact directly with the public on health topics. This could mean incorporating health messages into signage at public parks that promote physical activity. With funding, this could be used to help promote health as well. For example, health and equity criteria could be incorporated into requests for proposals. And guidance and best practices help to explain how health and all policies can be adopted. So for example, community health considerations could be added to land use or transportation plans with the help of guidance and best practice or instruction. And finally, the permitting and licensing process by government bodies authorizes particular types of activities, and health can be prioritized through these authorizations. So for example, an application of this is in neighborhoods that have few grocery stores. Municipalities could streamline the permitting process for farmers markets. There are a few main tools to start to incorporate a health lens to policy and program planning work. First, there is a health lens analysis. So there are several ways of conducting a health lens analysis, but the overall goal is to utilize a process to consider and deliberate both the positive and negative health and equity impacts of a policy decision. So the example on this slide is from the Tacoma-Pierce County Health Department's Health Lens worksheet, which is available on their website. And the questions shown on this particular clip ask a policymaker to evaluate the aims of a proposal and asks who will be positively and negatively affected by the proposal. Also asks who has been consulted on the proposal and who has not been consulted. In general, the Tacoma-Pierce County Health Department and the government of South Australia utilize health lens analysis in a lot of their policymaking, and both offer a number of resources online. My program, the Michigan Climate and Health Adaptation Program, informally used a health lens analysis to evaluate EGLE's My Healthy Climate Plan. This helped us understand various intended and unintended health impacts of the plan's goals and was helpful in identifying some of those co-benefits. And another way of including a health lens analysis is to simply bring on a health expert or a public health staff person to provide input on a proposal. A second tool, which you may have heard of before, is a health impact assessment. And so this is a more formal process typically. It's a tool designed to evaluate how a proposed program, policy, or plan may impact health and well-being. And it informs decision makers of these potential outcomes before the decision is made. The process includes a high level of community engagement and input typically. Therefore, it's best to use this if you have a very specific project or policy that you'd like to evaluate and understand. It can be costly and time intensive because of the high level of community engagement. But because of that high level of community engagement, it's been shown to have a high level of community buy-in, and it helps to avoid unintended negative health impacts. There is an abbreviated version of this tool called a rapid health impact assessment, and this typically includes a more internal review of the health impacts of a policy or program. And previously, my program funded health impact assessments. So two are shown here on the right. One was for the Michigan Street Corridor Plan in Grand Rapids, and the second is for a proposal to expand the tree canopy in Ann Arbor. Those examples are available on our website, and you can also check out more resources for health impact assessments at the CDC Healthy Places webpage. And I'll make sure you can get access to these links after this presentation. There's also a third link there for an overview of how Baltimore Health Department used a health impact assessment to evaluate the zoning code rewrite that they were doing in the city, which helped them identify ways to improve health through zoning, which I thought could be of particular interest if there are planners in the crowd today. So I've been talking at you quite a bit, so I wanted to try to involve an activity. Of the 5 elements in Health and All Policies framework, the first 3 are some of the most important. So considering the first element, which is to promote health, equity, and sustainability, if you all could take a minute to think about a policy, program, or process you've worked on in the past or that you're currently working on, how could health be incorporated into that policy, program, or process. For example, in a previous job, I was part of a team working to reduce building energy use, and there are certain energy efficiency measures that can also benefit health by improving indoor air quality. So even though my job was unrelated to health, I helped my boss research ways to incentivize energy efficiency that can improve indoor air quality and overall health. So that's just an example. It could be very simple, but I'm going to give you all like 30 seconds. And then if a brave volunteer could offer what they came up with, that would be great. So just a few seconds here to think about how health could be incorporated into a policy, program, or process you've worked on, or currently working on, or worked on in the past. Okay, are there any volunteers to offer what you came up with? You can just unmute and speak. We're a smaller group, so it can be a more informal discussion.
Hi, this is Suzanne from the city of Southfield. I can kind of quickly share what we're working on here. So I'm the sustainability planner here at the city, and we're currently working on drafting a brand new sustainability action plan. The city has never had one. So I can foresee health being incorporated as part of our quality of life section in our plan. And I didn't know about health impact assessments until this presentation. So I foresee us kind of doing an in-depth health impact assessment for the city and incorporating that as a project within our sustainability action plan. We plan on identifying current projects in the city, past projects to celebrate sustainability measures, and you know, a health impact assessment could be a future project for us. So that's kind of the initial thing that comes to mind for me.
Yeah, that's great. That's a perfect example. And I think a good application of the health impact assessment. Thank you for volunteering that. Anyone else have anything? There'll be more opportunities to participate. So we'll move on. Number 2 in the 5 key elements. So support intersectoral collaboration, and that just means collaborating with groups outside of your own division, department, agency. So how could you partner with a local health department or other health group in your jurisdiction? Kind of thinking about perhaps the previous example or what you were working on or have worked on in the past where you could incorporate health. How exactly would you decide to involve the health department or another health group? So again, I'll give you like 30 seconds and we'll share back. Okay. Any volunteers for this one?
I'd be willing to share something from a past role. Prior to working for the Michigan Municipal League and the Michigan Green Communities Program, I worked in a small community where we actually went through and did the like we redid the master plan, we did a zoning update and all of that while I was there. And thinking about the master planning process, I'd actually probably would have, we didn't do this, but it would have been a good opportunity to actually connect with the county health department at that point and maybe kind of dive into what, you know, what some of the stats are around public health issues in our community and also in the county, and see how we could have maybe influenced that through the plan.
Yeah, that's great. Andrew, I saw you went off mute. Do you want to share?
Yeah, I did. And apologies, I've got some bandwidth issues here. So I'm Andrew DeLue. I'm with Washtenaw County, and we're actually working on a county-wide climate action plan. Very exciting. We just released our plan for public comment yesterday. But our health department has been very closely involved in the creation of that plan. It's probably a little bit easier for us, at the county level and having the close proximity to our county health department. But the reason for that involvement has been for any of the reasons that you pointed out here, Julia, in terms of the relationship between health and climate. And so I think to your points, Danielle, we've really been looking at their involvement in the development of the plan, the actions listed in the plan as a means of making sure that we're thinking about health impacts with many of the decisions that we're looking to influence through the climate action plan that talk about what public spaces look like, what our infrastructure systems look like. So they've been great and would be happy to talk about that further if anybody's interested, but it's been really successful so far.
That's awesome. Thank you for sharing, Andrew. And yeah, with health departments are typically at the county level in Michigan, so it's definitely easier that you're working from the county level. But I think sometimes it's intimidating to establish that relationship with a health department. But once it's there, it can create really solid, a solid foundation for a longer term partnership.
Yeah, if I can just add one thing on that too, I think during COVID, we did a lot to try and improve the relationships and the communication between our health departments and the cities and townships and villages inside of the county. So we were really looking to take advantage of those relationships that had been recently built. So that was helpful, but it was challenging at the start.
Yeah, that's great. Let's see, Annabelle, are you off mute? Not to put you on the spot if maybe you weren't.
I think she might have just joined the call.
Okay, great. Well, those are
We
all
won't put you
really,
on the spot.
yeah, won't do that. Those are all really good examples. I guess to add from my previous example where I talked about the building energy use group that I worked with before, in that example, if we wanted to maybe bring on someone from the local health department who focused on healthy buildings or indoor air quality, that would have been someone I could have reached out to, or even a local professor who might specialize in something like that. That's a good way to involve the health perspective. All right, and the third step. So this work must benefit multiple partners. So this is more about co-benefits and kind of the win-wins. I think it's very similar to the first prompt, but it kind of goes beyond to show not just how your work's related, but how you actually benefit the kind of goals of both agencies. So are there health co-benefits to a project or policy you worked on or are working on? It's kind of the main prompt. So I think it's even going beyond to identifying them to knowing like how it overall benefits the mission of that group. So with my example, this could be if there's a way to measure indoor air quality improvement before and after an energy efficiency measure is taken, that's something the health department could actually use to evaluate as an intervention and be something that they could report on in kind of like their annual reports, in addition to serving the ultimate goals of the group I was working for. So this one's a little trickier, but if we'll again take 30 seconds to kind of think through what exactly are some of the health co-benefits to a project or policy. And again, if it makes sense to kind of use the same case study throughout all three, that could be helpful. So we'll take 30 seconds. All right, anyone want to volunteer what they jotted down? Going once, going twice. That's okay. We'll have more activities towards the end. And this one is pretty similar to the first question, so you're probably already thinking about it. Again, I just want to emphasize that health in all policies at its simplest means considering the health impacts of a public policy or plan. And if that's all you take away from today's training, but you do apply that to your work, that's already a huge step. So a third and final tool that I'll cover today for incorporating health into your work is the Climate and Health Adaptation Planning Guide for Michigan communities. This planning guide was created by my program in the Michigan State University School of Planning, Design, and Construction, and is based on work we did in Marquette County. As we've discussed, health in all policies can be as simple as adding health considerations into current plans or projects, and the Climate and Health Adaptation Guide stemmed from work in Marquette where existing climate plans were brought in to include robust community engagement around the connections between health, climate, and the built environment. A climate and health adaptation plan is a strategy document that fosters collaboration across disciplines and interest groups to instigate a series of activities toward the common objectives, which will prevent or reduce the anticipated impacts of climate change. The guide focuses specifically on how climate adaptation plans can include health equity, and it lays out steps for establishing that multi-sectoral steering committee, as well as tips on facilitating community engagement. In Marquette, this whole process helped establish a shared vision for a resilient future in the county, and it helped the group brainstorm policies, sketch up built environment designs, and deliberate infrastructure investments that were aimed to prevent or reduce health impacts from climate change. So while this tool is specific to climate adaptation work, its central methods align with a health in all policies approach. The 4 guiding principles to incorporating health into community climate planning are to 1, keep health and equity at the forefront of all action. Number 2, to engage decision makers and representative community members throughout the whole process. Number 3, to use locally relevant health, environment, and climate data and the necessary assessments. And finally, 4, to leverage visualization tools to establish a shared vision. So the first 2 principles here are very similar to the goals of health in all policies. So just generally centering health and equity in the work and engaging diverse stakeholders and working across agencies throughout the whole process. The guidebook is divided into 4 main phases for doing the work. The first is to engage stakeholders and identify their concerns. So this includes educating stakeholders on climate and health issues, then identifying the climate trends and populations that are at risk in that particular area, gathering concerns or solutions based on the stakeholder feedback, and finally establishing a leadership and steering committee to guide the whole project. The image on the right shows some of the climate and health concerns that came up during the Marquette stakeholder group. Phase 2 then engages the community and develops the plan. So the goal here is to engage and educate the broader community of where you're working on climate and health and how that relates to adaptation planning, and to then identify adaptation strategies. The third phase is to prioritize and implement the recommended actions. So here the steering committee or the project group would prioritize recommended actions, develop a plan for implementation, and then use community input to determine realistic recommendations, and ideally one that can utilize existing opportunities. And then the final phase here is to monitor, update, and keep the plan active. So one way the Marquette project had success was to incorporate the plan into other community policies and plans, and then to update the plan to ensure adaptation strategies continue to be relevant. And then the final goal throughout all of this is to evaluate the implemented interventions and to incorporate feedback into the implementation of other interventions. In Marquette, the early implementation brought ring garden construction. It also helped expand the non-motorized transportation network there. They created some on-street signage for bike routes. And finally, the climate and health content from the plan was added to the master plans for the cities of Ishpeming and Negaunee in that master planning process. And our final activity, the goal of the planning guide is to identify climate issues and investigate how they're impacting health. And finally, to use community engagement techniques to find locally specific adaptation strategies. You haven't had the opportunity to kind of get the Climate Health 101 and you don't have the full guide in front of you, but I was hoping as a group we could walk through some of the basic questions and see if we can find examples in your communities. And it sounds like if you're, we have some climate planning in the audience today, as well as sustainability planning. So I think this will be hopefully a little easier. So to start, how is your locality experiencing climate change? No wrong answers here. If anyone wants to come on mute, we're curious to hear how specifically where you live is experiencing climate change.
Hi, this is Emily from Marquette. Can you guys hear me okay?
Yes, we can hear you, Emily. Thanks for joining.
Yeah. So in Marquette, you know, a lot of this discussion has been around our involvement with the climate and health adaptation planning process, but just some observed trends would be shorter winters and hot and dry summers. A large thing would be warming Lake Superior water temperature, which really affects the precipitation and snow levels we see here, like lake effect snow.
Yeah, are there other people who have similar ones? Probably not the same. Obviously, you have some things that are specific to Lake Superior. I'm interested to hear if that resonates with other groups.
Yeah, I can share a little bit more. I think one of the things that we're seeing locally in response to climate change in the agricultural community is more installation of irrigation systems, like big center pivot wells, which, you know, one or two of them is not a whole lot, but those things pull up a lot of water from the ground table. So in aggregate, that's something that we're concerned about. In more of our urban areas, and this year was not representative, but the longer trends have been a lot hotter days in the summer, which necessitates starting up cooling centers and worrying about some of the more vulnerable in our community in terms of how they're avoiding the heat. And again, this year was milder than we've had, but that you know, the trends over time has been that those have been more severe in terms of temperature and were more plentiful in terms of the number of days. We've also had flooding too, so.
Yeah, thanks for sharing that. I think most often within my program, we talk most about flooding, extreme heat, to some extent, kind of extreme cold that we're seeing in the winters. So all of that tracks. The second question here, so how has it specifically impacted health? So not all those examples might have a direct impact on health, but most do. So how are you seeing these climate changes impacting health where you live?
I'll just pick one example from Marquette. So specific to extreme weather events and seeing more of those, an issue we have our emergency services. So a lot of Marquette County is very rural, and our 911 and mapping capabilities are not really what they should be. So seeing these extreme weather events and flooding and roads being highly impacted, getting to areas to assist people is an issue, and definitely will be an issue in the future.
Yikes. Yeah, so the importance of preparing emergency responders to deal with these kind of increasing and changing threats that climate change presents. Yeah, very complicated problems. We're going to go ahead. So a third question would be like how specifically your locality could prevent or reduce health impacts of climate change, but this is a little bit more advanced if you're not familiar with some adaptation strategies. So I'm going to end on, given what we've talked about today and a health and all policies framework, how could this help you work towards a goal of incorporating more climate and health planning into your work, or considering the health impacts of climate change, specifically where your work. So I'm curious in Washtenaw with the climate plan you're working on, how has the health, you kind of talked about working with the health department, but maybe if you want to go into more specifics of how they've actually been involved, like are they on a steering committee? Do they attend meetings? Do they just review stuff and provide input? Like how is that working for you, or how do you see it working in the future?
Yeah, I'd be happy to. So they are a component of our steering committee. The county's environmental health director is a member of that, and we pulled in our health officer as needed. Our climate action plan, there's both the emissions mitigation component as well as adaptation goals. And so a lot of where the health department comes in is around adaptation and resilience. So with our draft plan, we have a whole section of recommended actions that are really focused on health. And those have us calling for increased resilience hubs, the cooling centers, but also, places where people might be able to go when the power goes out, or if we need to do food or water distributions, places. We had big flooding that got an emergency declaration a couple of years ago. And so a place where people could go following a flooding, as we had in that situation, is kind of the thought behind that. But we've got a whole series in there that are intended to pair with the emissions, the emissions reductions actions, given that we need to both stop climate change and also prepare for what's already happening. So they've been great. They've also done a lot to introduce us to a lot of the community groups that they work closely with, to put us in contact. I think to Emily's point around the emergency management side, to work with our hospital systems and those people who respond and provide healthcare in the wake of emergencies, given that there's some interest from them too in terms of trying to be more planful about how we'll deal with the impacts of climate change here.
That's great. And then specifically within the Washtenaw County Health Department, are you working, like, is it the top leaders? Is it in their environmental health kind of division?
So we've got support from the health officer, and she's there and is able to make connections when we need her. She's got a couple of her deputies who are directly working on this plan, and then they also have an emergency manager or emergency preparedness manager who works in coordination with the county's emergency operations manager, who's more out of our sheriff's office. But given a lot of the preparedness work that we're trying to take to our planning efforts, that person has been involved as well as just a whole bunch of staff who are generally interested in the plan. And we've had very strong staff support for the planning effort too.
That's awesome. Really glad to hear that, and excited to see the draft plan when it's out for public review. All right. Thank you all for participating. So in summary, social determinants of health are the conditions in which people live, work, and play that can impact their well-being. Health in all policies means incorporating health considerations into decision-making across sectors and policy areas. And you can weave health in all policies into existing processes. So by considering the health impacts of a policy or program, you can also communicate the health co-benefits, and you can utilize tools such as the health lens analysis or health impact assessments. And finally, climate and health adaptation plans are strategy documents that foster collaboration to develop activities that prevent or reduce anticipated health impacts of climate change. So these are the main points from today's presentation. To start to incorporate health into your policymaking, these are some resources on where to find local health data. There's the Robert Wood Johnson County Health Rankings. There's also a National Environmental Public Health Tracking Network, which is run by the CDC and provides general environment and health data. And then the state version of that is called MICHAP, and it has Michigan-specific data on environment and health topics. And you can also refer to community health needs assessments, which are usually conducted by local hospitals or your local health department. And then there's contact information on the right to locate your health department and find some of the staff. These resources I used to create this presentation. So there, I think some of the top ones I'd recommend. There's the American Public Health Association's Health in All Policies Guide for State and Local Governments, which we talked about quite a bit. There's also the American Planning Association. They have the Health in All Planning Policies Toolkit, as well as a fact sheet that I showed earlier. There's also more resources at the CDC. And then on the right column there, you see a link to our climate and health adaptation planning guide, as well as a link to more of our health impact assessments that we've done in the past, so you can see examples. And then finally, there's the Michigan Department of Health and Human Services Social Determinants of Health strategy at that link there. So thank you all. We have some time for some Q&A, but if you have any other comments or questions, feel free to email me at fieldj@michigan.gov. And yeah, I'm happy. I think we have about 10 minutes here. We can open it up for Q&A or even just a discussion if you're trying to incorporate health into the work you're doing and it sounds similar to Washtenaw, like it's a good time to kind of trade stuff amongst y'all as well. So feel free just to come off mute, or there may be Q&A going on in the chat that I was unaware of, Danielle, so feel free to let me know.
There was one question in the chat about whether the slides would be shared later. And would you feel comfortable in a follow-up email if we shared these slides with those that attended today?
Yes, definitely.
Okay, great. For those that are here to give us about till the end of this week, we can put together the slides, the recording, and any other resources and links and things like that were mentioned. We'll have all those available for you. Any questions or anything from this discussion today? First of all, thank you so much, Julia. This really was fabulous. I think there's a lot of useful information here, and thank you for breaking it down in a way that's not overwhelming for especially for those that work in local government who have a million things on their plate already. So if anybody has any questions or anything they want to follow up on, go ahead and feel free to jump in.
Yeah, this is Emily from MICHAP. Just wanted to say thank you, and I really liked all of your slides. I was curious if I could maybe use some of your slides in a presentation I'm doing on Friday. So
yeah,
okay, that would be awesome. Yeah, I really liked some of the ones you had in the beginning. And we've done a few presentations about the climate and health adaptation guidebooks before, so I already have a lot of information on that, but I really like the planning and public health kind of intro you had.
Yeah, we'll definitely share all the slides, but I can make sure that you get a copy before Friday, Emily.
I appreciate it. Thank you.
Of course. And I can add to that, my program, so the Michigan Climate and Health Adaptation Program, we generally provide a lot of technical assistance. So if something comes up and you're curious, or you think you'd like to kind of talk through with someone how to involve local health, we're happy to help make that connection with the local health department where you work, and also kind of talk through a strategy, perhaps, if that would be helpful.
I'm gonna hop off. I just want to say thank you, and this is really important work. This is a really important way to tell the story and connect your community to this work, and not make it more tangible, not make it as scary as climate change is. So good job. Thank you.
Thanks, Emily.
All right. Anything else from anyone? If not, we can give y'all a few more minutes back in your day, and we really appreciate you joining us. Definitely continue to take a look at the michigan.gov/climate and health. DHHS has a ton of really great resources on there. And if you have any questions on Michigan Green Communities, visit our website, mygreencommunities.com. And please feel free to engage with us more. If you have any questions about it, want to learn more about the challenge, reach out to me. There's a contact page on the website. So that's all we have. We can give Julia a virtual round of applause for